Good morning, everybody. My name is Zoe Harris, and I'm the founder of Mycarematters. And I'd like to start today by introducing the man who's inspired the work that I've been doing for the past 5 years, my late husband, Jeff. Jeff had dementia, and he was unable to do those basic tasks towards the end of his life, like washing, dressing, feeding himself. And he was unable to communicate in the conventional sense. Communicating our needs is something that most of us take for granted, but Jeff was unable even to tell the people who were caring for him that, yes, he'd love a cup of tea, and he'd like it without milk. And that may sound unimportant, but when well-meaning staff are offering you cups of milky tea that he wouldn't drink, it meant that he became severely dehydrated. Dehydration is one of those metrics that hospitals monitor to as an indicator of their quality of care. So it's well understood that dehydration is a far greater risk to people with dementia than average. In fact, because Jeff was unable to communicate, mistakes would keep happening in hospital and then in the care home where he spent the final 13 months of his life. So I developed a wall chart to share the information that I knew Jeff would want to talk about if he could, with people caring for him. And it turned out there was a real need for something like this, for staff to provide person-centered care to the millions of people unable to communicate their needs and preferences. Variations of that original chart are now in over 1,200 care homes and hospitals throughout the UK. A trust running 14 hospitals ran a 6-month trial to establish the benefits of the charts, and they were able to reduce a patient's average length of stay, and that has massive significance, and I'll explain why in a minute. But first, let's look at why we can't continue with things as they are. We have an aging population in Europe, and our healthcare systems are already creaking under the stress of that. The cost of dementia to Europe in 2009 was 160 billion euros, and that figure had gone up by 2015 to 269 billion euros. And that number is going to carry on going up and up because the numbers of people contracting dementia are doubling every 20 years. The people with dementia are already occupying 25% of hospital beds throughout Europe, and their average length of stay is more than double for someone without dementia. So the cost to the system is of massive significance. And if we can just reduce the average length of stay by 1 day, it means that we're saving the European healthcare systems a massive 300 million euros every year. So we knew the care charts were having a massive benefit. But we wanted to find a more reliable way of sharing somebody's information with hospital staff without delay, so people could create a record at home. And the obvious way to do that was to use the internet. So we developed Mycarematters, an online platform where people can upload the information they want to share with hospital staff, information that's needed in order to provide person-centered and holistic care. A record can be created and updated, viewed on screen and printed out via any internet-linked device anywhere in the world. We've already got 3 trusts using the service with 16 hospitals serving 2 million people in the south of England. They're paying to use Mycarematters, and we're in talks with a further 7 trusts as well. But there's a lot more to be done as tech develops. Alex, our creative director, is going to give you a hint of the vision that we have for the future of Mycarematters.
This is an interface we're all familiar with, the interface between the doctor and patient, typically a short conversation and some paper notes. But patients now are more educated and equipped to look after their own health and want the opportunity to be able to share information with the doctors. And there is currently no window of opportunity for that. Ownership of medical data has always resided in the hands of the medical professional. But this relationship between parent and child, of the doctor and patient, is changing and is becoming more of a partnership. And we at Mycarematters want to facilitate this partnership. And we see ourselves as being the interface between the patient and the medical profession. So let me introduce you to Elizabeth. She likes to be called Liz. She has poor eyesight, drinks her coffee black, listens to the radio, and wears a smartwatch to monitor her health. At Mycarematters, we want to paint a full and complete picture of Liz, not just the medical data. We see this as a tool for not just the old and infirm, but potentially for everybody, everyone who wants to communicate a better image of themselves to the medical profession. We're not naive to the scale of this ambition, and that's why we've founded the Design Collective, a group of young, talented designers that are working tirelessly to perfect and hone our product for both our users and the medical professionals.
So I'm very proud that our work has already been recognized by a number of organizations, but as Alex says, there's a lot more that we can do. We're already scaling, we're talking to a number of potential partners in Europe, and we're looking at how we can improve the product to meet the needs of other potential beneficiaries. Our business model allows individuals to create records for free and then to subscribe for premium services. Hospitals and care homes are purchasing annual licenses based on numbers of beds. And we have a further revenue stream where we will sell data to inform decisions about the future delivery of care. It's World Alzheimer's Day today, so it seemed appropriate to launch our first national advert. This has gone out in The Guardian in England, with further publications booked in future weeks. 9 million people are living with dementia in Europe today, and 75% of those will experience a stay in hospital. We can improve the outcomes of those people with Mycarematters, and with your support, we're already reaching thousands of people with our service, and with your support, we can reach thousands more. Many thanks.